Hello, I'm Dr. Tharaka, urologist at Akkineni Hospitals. Hope you are well. In this session, we'll cover key information. Stay with us and jot it down.
Welcome to this explainer. Look, today we're tackling a medical topic that's usually surrounded by a thick cloud of stigma, silence, and honestly, a lot of misplaced shame. But as you'll see from the data we're about to unpack, understanding this condition isn't just about your quality of life. It is quite literally about your survival. We are talking about erectile dysfunction and how it acts as an early sentinel for your overall health. Here's our roadmap for the next few minutes. We're going to cover the elephant in the room, look at why it's a warning sign for hearts, dig into understanding root causes, walk through the evaluation process, and wrap up with proven treatment options. Let's get right into it. Part 1. The elephant in the room. It is time we totally shatter the stigma around this. Let's just look at the hard numbers for a second. 150 million. Worldwide, an estimated 150 million men deal with erectile dysfunction. Think about that. That staggering number proves beyond a shadow of a doubt that we are talking about an incredibly common medical issue. It is a biological reality for millions of guys, definitely not some isolating personal failing. Now, what's really wild and genuinely tragic, honestly, is the gap here. Look at India, for instance. Surveys show that over 50% of men over the age of 40 experience some degree of ED. But get this, fewer than 20% actually go seek medical help. Why? Mostly because of shame, stigma, or this completely false idea that ED is just a quote-unquote normal part of getting older. That silence is keeping guys from getting life-saving care. Moving on to part 2, a warning sign for hearts. We need to look at why staying quiet about this is actually really dangerous. I want you to ask yourself something. What if a simple ED consultation could literally save your life? We've got to radically shift how we look at this whole thing. We need to realize that this dysfunction, it's often the body's very first check engine light for underlying systemic disease. Think of your cardiovascular system like a massive network of pipes. Penile arteries are tiny. We're talking maybe 1 to 2 millimeters across. Coronary arteries, the ones feeding your actual heart, are significantly larger. So it's just basic plumbing. Because those penile arteries are so small, they get clogged up with plaque years before the bigger pipes leading to the heart do. It happens first simply because the smallest pipes block first. Makes sense, right? Because of that plumbing reality, here's the crucial takeaway. Men with ED have a 2 to 3 times higher risk of future cardiovascular events. 2 to 3 times. Because of this, a full cardiovascular risk assessment isn't just a nice to have, it's considered absolutely mandatory for any guy over 40 who suddenly starts experiencing ED. Basically, your body is waving a giant red flag, giving you a massive head start to prevent a heart attack or a stroke. Okay, part 3, understanding root causes. Let's figure out why this actually happens. So, what actually breaks down in this whole complex system of blood flow and nerve signals? Well, vascular issues are the main culprit, making up the vast majority, averaging right around 60% of all cases. We're talking about conditions that rough up your blood vessels, things like hypertension, diabetes, and high cholesterol. Simply put, if your blood vessels are compromised, your erectile function is going to be compromised too. But what about the other 40%? That's a wider web of factors. You've got neurological issues, like nerve damage from pelvic surgery or a stroke. You've got hormonal imbalances, like low testosterone. Then there are psychogenic causes, things like performance anxiety and just everyday stress, which, by the way, are super common at any age. Even daily medications like SSRIs for depression or certain blood pressure meds can trigger it. And finally, there are structural issues, like Peyronie's disease. It's a lot of different things, right? All right, part 4, the evaluation process. Let's demystify the doctor's visit. Knowing there are these very real physical root causes, how do we make getting help a little less intimidating? Look, the clinic visit is entirely straightforward. Step 1 is just a detailed history. Step 2, a standard physical exam, checking blood pressure, things like that. Step 3 is basic blood work, checking your morning testosterone, blood sugar, and cholesterol. Step 4 might be a penile Doppler ultrasound just to check the actual blood flow. And step 5, as we've been hammering home today, is that mandatory cardiovascular risk assessment. It's totally routine, super clinical, and there is zero reason to feel embarrassed. Which brings us to part 5, proven treatment options. Let's talk solutions. Here is the absolute most reassuring part of this whole explainer. There are highly effective treatments to fix this. But before we jump to a magic pill, we have to talk about the eat your veggies of medical advice. Lifestyle modifications. Exercising, losing weight, quitting smoking, getting your blood pressure in check. Optimizing your baseline health is foundational, mandatory treatment. It's not an optional extra. In fact, some studies show getting the right exercise can be just as effective as medication for certain guys. Crazy, right?
Now, when medical intervention is actually needed, there's a really clear progression. First-line treatments are your standard pills, like sildenafil or tadalafil. They boost blood flow and work in about 70% of cases. Pretty solid odds. If those don't do the trick, or if you can't take them because of other meds, we step up to non-oral therapies, like vacuum devices or highly effective injections. And finally, for severe cases, the gold standard is a surgical penile implant. It's a permanent solution, and get this, it has a staggering patient satisfaction rate of over 90%.
But hey, we absolutely cannot ignore the mind here. Even if the root cause is 100% physical, the stress of dealing with ED takes a massive toll on you. Psychosexual therapy is absolutely essential if anxiety or depression are in the mix. But honestly, it's a huge help for all patients. It helps you navigate the relationship dynamics while you're going through medical treatments. Treating the whole person always yields the best results.
As we wrap up this explainer, I really want you to take away this one quote. ED is not a personal failing, it is an early sentinel of your systemic health. That right there is the fundamental, life-saving shift in perspective we've been driving at today. It is an alarm bell, giving you the gift of time to fix your heart, endocrine, or neurological health before something far worse hits.
So I'll leave you with this final thought. If the check engine light came on in your car, you wouldn't just slap a piece of duct tape over it, right? So, will you ignore your body's check engine light, or will you take control of your health today? Please, don't let misplaced shame keep you from a straightforward medical evaluation. Getting checked out can restore your confidence, bring intimacy back to your relationship, and honestly, it could quite literally save your life. Thanks for joining me for this explainer. I'll see you next time.